Hi, Dr. Erickson here. I want to visit with you shortly about what are the goals of our clinic. Now, we have people who attend our clinic from various different towns throughout Colorado, and they come in for various different reasons or symptoms. But as we evaluate them, we inevitably find that there are some major influences with both the metabolics and the neurological side of the brain. And so now our goal becomes not just simply to alleviate and address symptoms. As a matter of fact, we don't treat people or symptoms with people. We treat people who have symptoms. But our goal is to actually help to improve and the balance of the neurological side. So let me go through them. There are 3 of them. I'm going to give you a short discussion of each one as well. Our first goal with a patient who comes into our clinic is that we want to stabilize the autonomic nervous system. Now, the autonomic nervous system is also called your automatic nervous system. It runs in the background. There is really no need for you to think about it. It controls things like your heart rate, your blood pressure, breathing, digestion, sweating, your body response to stress, etc. Now, when it comes to questions and concerns about hormone control and balance, whether it's the female hormones, I've got hot flashes and mood swings, or you're simply dealing with thyroid hormones where my TSH has skyrocketed, the autonomic nervous system is still a player. It's because of the control in the brain that originates and affects the control of hormones in the body actually originates in this area of the brain. Another aspect of the autonomic nervous system is what we call fight or flight. Now, many of you have probably heard this term. What fight or flight is a special part or response by the nervous system to situations of stress or danger. For example, if you're hiking through the woods and a bear jumps out, your fight or flight response is going to kick in. At this point, you have 2 options. You can attack the bear and beat him up, which is probably not going to be very likely, or you can run from the bear. And what you'll probably notice as you're running from the bear is that you are able to run faster than you've ever run before. You may be able to even jump over things that you never could have jumped over under different circumstances. And that's part of the response of the body kicking in that fight or flight response. It's pumping more blood and adrenaline to the muscles that would, in your arms and your legs, that would allow you to get away. Another thing that happens is that certain areas of the body slow down and become sluggish during a fight or flight response. One of those areas would be your gut and your digestion. Think about it for a minute. Last thing you want to do is to have to stop and take a pit stop if a bear is running after you. So the body actually becomes more sluggish and it slows down certain areas in response to a fight or flight response. Other areas can actually speed up. Your heart rate, your blood pressure. These things are going to jack up or increase in a response to helping that body get out of the danger situation. Now, your autonomic nervous system is what controls the fight or flight response. Unfortunately, miscommunication and breakdown in the autonomic nervous system can lead to a situation where you're sitting in your living room or you're sitting in your cubicle or at your desk at work, but your body and brain are still responding as if you have a bear prowling around in the room with you. This can lead to elevated blood pressure, the same symptoms and things that we talked about earlier. Elevated blood pressure, increased heart rate, a sluggishness of the gut and digestion. Excuse me. So it may not be that medication is the fix for these particular situations. As a matter of fact, if you've tried every fiber product on the market, if you're on multiple forms of blood pressure medication, and you still have these symptoms, you want to consider balancing out your autonomics. The next goal of our clinic is balancing both hemispheres. The hemisphere relates to the right side or the left side of the brain. We deal often with situations called functional disconnect syndromes. What that means is there's an area of the brain in your child that's not functioning and in communication with other areas of the brain. Most typically in the case of ADD and ADHD, you're talking about a right brain functional disconnect syndrome. Now, a healthy brain is a balanced brain. So a weakness or a deficiency in one side of the brain is going to create imbalances, and this is what is going to lead to abnormal function in the body. Now ponder just for a moment, what does the brain control in the body? Well, the simple answer is that it controls everything. And so if we have an imbalance of the brain, what could begin to malfunction in the body? The answer again, anything could happen. And so balancing the brain is critical for allowing a healthy body to function and a healthy young person to develop. Now, the third item is probably my most favorite. They're really hard to classify which one is more important than the other, but the third one just really rings with me here. The third one is that a goal in our clinic is to prevent further neurodegenerative disorders. What is a neurodegenerative disorder? It's a situation where the brain has deteriorated to the point where now you are labeled with certain types of conditions. For example, Parkinson's, Alzheimer's, dementia, multiple sclerosis, etc. Not only is my concern with helping to alleviate and address symptoms that my patients may be dealing with when they present to my office, but it's also keeping an eye on their future. What can we do to change now to prevent things from happening later on? Do you know that there are 8 stages to Parkinson's, and the very last stage is the tremors? Yet, when do most people who have Parkinson's get their diagnosis? In their last stage. It's too late then. The damage has been done. There is really not a whole lot that can be done. As a matter of fact, to date, there is really nothing that can be done to reverse things at that stage. Medications can be used to manage symptoms, to maybe control the negative aspects of some of the neurological decay, but as far as rehabilitating and fixing, we've really lost a lot of ground. Did you know that poor short-term memory, when you're at 25 or 35 or even 40 years of old, can be an indication that you're walking the path towards Alzheimer's or dementia? Not saying that it's a surefire thing. However, what we are finding now, that early warning signs for dementia later on in life start with loss of short-term memory, walking into a room and not knowing exactly why you're there, carrying on a conversation with a friend and realizing partway through the conversation that you have no idea what you're still talking about. The issue here is that when is it better to deal with neurodegenerative problems? When you have the diagnosis or before? Well, the correct answer is before, as in right now. So identifying what types of things are at work now in your child's life or in your life, both neurologically and metabolically, can help us to formulate plans that will allow us to head off future neurodegenerative processes. So by properly identifying these areas and working on them as soon as is humanly possible, allows you now the opportunity to function normally over a long period of time. This is Dr. John Erickson, hoping you enjoyed learning about what our clinic goals are. Have a wonderful day.